Hello, Tony Trongone, Superintendent of Millville Public Schools, here with a Part 3 update of our school opening plan. Topics to be discussed will be social distance, mask and screening protocols, sick leave, and response to positive cases of COVID. But first, some bits of news. On Monday, August 3rd, we'll have our board meeting, which will be held at 7 p.m. The meeting will be held virtually, and information of accessing the meeting virtually will be on our district website. There'll be regular business, but also a review of the draft of the reopening of schools plan. Equity, diversity, and social justice. On August 4th and 5th, our equity and diversity team will be meeting. And we have a guest speaker in Mr. George Guy, who will be addressing culturally responsive teaching. But also the group will be building a direction for the district in equity, diversity, and social justice. The district has also taken on Dr. Bob Jarvis as a consultant in this area. He's the director of the Penn Coalition for Educational Equity. And his first steps with our district will be at a board retreat on Saturday, August 8th with our board members. And also we've joined the New Jersey Consortia for Excellence Through Equity. We're excited about being a part of this group, and they offer many events and activities that'll benefit our staff and our students. And finally, the opening of school. For teachers, September 1st and 2nd will be staff in-service days, and for students and teachers will be the first day of school. And now for our information session, part 3, will be our Assistant Superintendent, Donna Meyer. Donna?
Welcome to our next school reopening session. Today we will focus on health and wellness for staff and students. As Mr. Trongone stated a few days ago, the plan is still in draft form and will be an ongoing process. What do we already know about COVID-19? COVID-19 is a highly contagious respiratory illness caused by a virus. Most cases of COVID-19 are mild to moderate, like the common cold. However, some cases can be more severe in older adults and people with chronic health conditions. The virus is most likely to be spread from person to person by respiratory droplets released when people talk, cough, or sneeze. It is thought the virus may spread to hands from a contaminated surface and then to the nose or mouth, causing infection. What is the district doing to help prevent the spread? Staff and students will be required to wear face coverings while on the bus, at drop-off and pickup locations, on school property, when entering buildings, and in hallways and classrooms. CDC guidelines highly recommend students and staff wear cloth face coverings to school. Wearing a cloth face covering will help protect people around you, including those at higher risk of severe illness from COVID-19 and who frequently come into close contact with other people. The district will supply one cloth face covering for each student and staff member. Staff and students are permitted to bring their own face coverings as well. Like the CDC, the district recommends cloth coverings as they can be washed and reworn. Frequent mask breaks will be given throughout the day, with social distancing being enforced, as we realize wearing a mask all day may be difficult. Wearing a mask will be enforced to protect students and staff. Students who refuse to wear a mask will be educated on the importance of protecting themselves and others. If they still refuse, parents and guardians will be called to pick up the student. Continued refusal will result in student being placed on remote learning. What should students or staff do if they cannot wear a mask due to a health concern? Individuals should seek medical advice from their physician. The district will explore other measures with the individual, taking into account the advice from their physician to reduce the risk of COVID-19 spread. The district will follow HIPAA laws and will not identify medically compromised staff and students openly. IEPs, 504s, and accommodation plans may be developed to assist individuals with medical concerns. Visitation to the building should be by appointment only. Visitors will be required to wear a mask when entering school buildings and while inside the building. Refusal to do so may deny access unless there is a verifiable medical reason to not wear a mask. What other safety measures are being taken? Students are still required to get vaccinations prior to the start of school. Please check with your child's physician to ensure your child is up to date on his or her immunizations. Nebulizer treatments will not be given to students in the nurse's office. Parents should contact their child's physician to discuss treatment plans. Separation areas are being created by school nurses to separate ill and well students. Plexiglass splash guards have been ordered and will be placed in highly visited areas, such as reception desks, main offices, and classrooms where needed. Hand sanitizer bottles and dispensers have been ordered by the facilities department and will be placed in every classroom. Signage and decals will be placed around the buildings regarding COVID-19 information, health tips such as hand washing and wearing of masks, and social distancing marks. What are the qualifying reasons for leave related to COVID-19? An employee is entitled to take leave related to COVID-19 if the employee is unable to work, including unable to telework because the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19, has been advised by a healthcare provider to self-quarantine related to COVID-19, is experiencing COVID-19 symptoms and is seeking a medical diagnosis, is caring for an individual subject to a federal, state, or local quarantine, isolation order, or self-quarantine as advised by a healthcare provider, is caring for his or her child whose school or place of care is closed or child care provider is unavailable due to COVID-19 related reasons. Please note that all leave requests must be supported by medical or school closure documentation. What if a student is unable to participate in face-to-face instruction? Per Government Murphy's directive, students may choose remote learning full-time. Will teachers be approved to teach remotely? There are several factors to be considered. Telework is not guaranteed and will be reviewed on an individual basis. Student demand for online learning will drive staffing needs. A questionnaire was sent out to parents surveying student-parent preference, the hybrid model versus remote. The district will review the results of the survey and plan accordingly. Teacher placements will be contingent upon student enrollment numbers. It would also be based on teaching certifications and the teacher's eligibility for accommodations or leaves under federal law. Staff have been asked to submit their requests for leaves by completing a survey by July 31st. Attendance concerns. Leave time will be provided to staff affected by COVID-19 related reasons for emergency paid sick leave or family medical leave or extension under the recent provisions of the Families First Coronavirus Response Act. These days do not count against the employee's attendance. Normal employee sick time will continue to follow Millville's attendance policy. Students. Parents of students who are directed to quarantine should contact the school. With medical documentation, absences will be excused during this time period. Normal student sick time will be documented and may be excused with a physician's note for the specified illness. Health screenings. How will health screening be conducted for students participating in face-to-face instruction? Parents and guardians who choose face-to-face instructional option for their child will be required to complete a parent-guardian health screening commitment form. This form is a commitment to complete a daily health screening each morning prior to sending the student to school. Students should be kept home if they are sick or running a fever of 100.4 or higher. Temperature checks will be taken daily prior to student entrance into the buildings. Staff will complete a check-in survey each day prior to entering the building. The survey will be available online and will be monitored by administration. All staff will be encouraged to stay home when they are feeling ill or display a fever of 100.4 or higher. Infinite Campus has introduced a new tool called the Daily Health Log and will be with the other health tools under our student information system. The tool will have its own tool rights so that non-health personnel, such as teachers and administrators, can make log entries. We are exploring parents being able to use this for daily logs prior to students entering school. Will parents, students, and staff be notified of a positive COVID-19 case in their school? Millville will follow the guidelines and protocols of the County Health Department. Positive cases will be reported to Cumberland County Department of Health. Schools will work closely with the Department of Health in identifying all close contacts of the affected person. A case investigator and contact tracer will be assigned by the Department of Health for all positive cases. What if someone in the community, student, staff member, sibling, that does not attend the school or parent tests positive for COVID-19? The Cumberland County Department of Health will complete a contact tracing investigation of individuals with confirmed cases. The Department of Health will act in accordance with the findings as it relates to quarantine individuals or closing a particular class or school. Thank you for listening in today. We will continue to focus on the health and well-being of our school community, not only now, but throughout this process.
This information can be found on our district website, on our district Facebook page, through text messages, and through email. Thank you.